Hi, everybody. My name is Kelsey Romney, and tonight we are excited to have another 4-H interviews with pros. Tonight we have Crystal Burtis. She's a physician assistant and she's works in a pediatrics office and family medicine. And interviewing Crystal, we have Reagan Falconrath. She's a 4-H Northern Region Ambassador and FCS State Ambassador from Salt Lake County. Reagan, I'm going to turn the time over to you.
Perfect, thank you. Thank you for joining us today. Would you mind by starting out by just telling us what you do as a physician assistant and what a typical day at your job looks like?
Okay, so as a physician assistant, sometimes we call ourselves mid-level providers. A lot of times you go to the doctor and you actually see a PA. We can prescribe medications. We can order tests. We take care of patients. I mainly work in a pediatric office, and so a typical day for me, I do a lot of the well child checks. So as kids grow up, every day from the 5-day visit, so right when the babies are first born up to about 18, all the different, well child checks. So we make sure they're meeting their milestones, getting their vaccinations, answering like behavioral questions or any questions the moms has. I also do a lot of same day sick. So when kids get sick, a strep or flu, they come in and they see me and we try to make their day better. So just a lot of different things. So
Awesome. I love that. What makes you excited about your job?
I love taking care of kids. I love seeing the excitement of the parents when they bring in their 5-day-old baby. And, I love seeing the kids like grow and progress because, you form a relationship with your patients, especially in the beginning, because they come in about every 2 months, for shots and vaccinations. And so I love like getting to know my patients. I love getting to know my teenagers and helping them. So I guess what makes me excited about my job is just forming that relationship with my patients and getting to know them and, help them and make their life or day better. So.
Oh, I love that. That's awesome. Thinking back, do you notice any interests that align with that you had as a youth that align with your current career today?
Yeah. So, as a youth, I was very involved in 4-H. I love 4-H. I have so many good memories of 4-H. I grew up doing horse 4-H. I show up growing lambs in 4-H. I even think I did like a sewing camp through 4-H once. And especially like with, like growing up with horses, I love taking care of my horses. And I even, I love learning about them and the science behind them and caring for them. And those kind of interests of just, caring for something, really is something that I love doing as a PA. And so it's just like that caring for someone, helping them when in need and learning the science behind things. And then just so a lot of the responsibility and caring for things I learned in 4-H. So I love 4-H.
Oh, I love that influence that you've learned from that.
Yes, so much of it. So
Yeah, I can see that. What type of education and training prepared you to be a physician assistant?
So, to become a physician assistant, you first you have to get a bachelor's degree, and so I did my bachelor's degrees in public health, and then I did the prereqs for PA school, and so become a physician assistant. It's a master's program, and so after my bachelor's, I went on and got my master's, and then at the end of that, you take a physician assistant certification exam, and then you can be a PA. So it's awesome.
I love that. That's so cool. I haven't really thought about that before.
It's a beautiful career because if you want to go into medicine, especially at PAs, because I can work in any field. Right now, I work in pediatrics, but if I wanted to in a few years go to emergency medicine or work in dermatology, it's you can work in any field of medicine, and it's kind of nice if you want that medical background and kind of help people, but you don't want to go all the way to med school. And especially when you go to med school, you have to specialize in one area. So once you do family medicine, you're forever in family medicine, or you're forever kind of in emergency medicine. I love the variety of being a physician assistant gives me. And so I love my field. I love my job. So
Yeah, it sounds to me like there's quite a bit of variation. So
there is. So you're trained a little bit on everything. It's awesome.
yeah, that's great. What is the average pay for a person in a physician's assistant position?
So the average pay, so when you talk, it's about 80,000 to 120,000. So
Oh,
per
wow.
year. So around there.
Awesome. Okay. What types of skills are necessary for succeeding as a physician assistant?
Well, I think to be a skills is, you have to have like a clinical background. You have to have kind of that research oriented base kind of mindset, because people come in with their problems. You have to have like critical thinking skills, like what it could be, what am I going to roll out, what test. So just kind of a critical thinking mindset. Communication is something else, it's huge, communicating with my patients and, their parents and, other people who I'm working with in the medical field. So good communication skills is important. Compassion, I think, is, another important skill set. And so probably those are the top three. So
That's really cool. What are some of the biggest challenges you face in this field?
gosh, some of the biggest challenges, that's a tough one. I was thinking about this question earlier and I was like, gosh, what am I going to say that was the biggest challenge? And I think for me, sometimes when I have to deliver bad news to a patient is always challenging, or, something that, they might not agree with, or things like that is always a challenge, because sometimes people have different views on different things. Everyone has their opinions, maybe on vaccinations or a certain way things are done. And so just, being professional and communicating and, and different things. So that makes sense.
Yeah, no, yeah, totally.
But most of the part, I love it. So
Yeah, exactly. What is the most valuable reward that you've reaped from this career choice?
Promise Bible is, I don't know. I love what I do so much. Like I never dread going to work. I'm always excited to go to work. And so I truly love being a PA. And I love, I just, if you have sick kids and, they just don't feel good, or something off in their life. And if you can just help someone just a little bit have a better quality of life, or improve their happiness, or, just try to help them, I find so much happiness in doing it. And it's fun. And I have the best patients. So I love it. So that's probably most rewarding is my patients are so great and I love helping them. So
That's awesome. You're kind of like convincing me to like go into the field now.
you should. It's the best field. I
Sounds
love
fun,
it so much. You should look into it. It really is the best field of all.
yeah. I mean, I believe you so far. What advice do you have for someone considering a career as a physician assistant?
If you want to be a PA, I guess like the school line, if you're in high school, maybe go get your CNA or your MA, because something big getting into a physician assistant school is they like people who already have a medical background. So if you've already been a CNA for a bit, they want medical hours experience because it's kind of an accelerated program. So so if you want to get your kind of feet wet in the medical field, so, become a CNA or a medical assistant, start taking some science classes because it is very science oriented. So maybe see if you like biology and chemistry. A lot of high schools offer like a basic anatomy course. So kind of get your feet wet there and, and see if the medical field's something that you enjoy. And then once you get to college, just get a pre-med type of degree, and you can do anything. You just have to take the prereqs and then just be persistent. It's competitive, but you can do it. Just, if you want to do it, you can't give up because it's kind of a long road, but you just got to believe in yourself. So
Awesome. Yeah, I love that.
there's definitely times when I wanted to give up where I was like, I don't think I'm going to get in. It was so much work. And now I've been a PA for 3 years and it seems like forever ago. So when I was applying and taking classes. So
Yeah, it must have paid off.
it's, yeah. So yeah.
Well, thank you so much for allowing me to interview you today, and answering some of our questions.
No problem. Okay.
Thank you guys both so much. I really appreciate it from both of you. That was so helpful to know, and sounds like such an interesting career and with so much flexibility. It's like something you're very passionate about and you have flexibility for. That's really, really cool. That's amazing. So I just want to let everybody know that Utah State does not offer a PA program, but they do offer a bunch of undergraduate, just like Crystal just mentioned. They offer a bunch of undergraduate options. And so if you go on USU's website and you look at their degree finder, you can type in physician assistant, and a whole bunch of undergraduate programs will populate that you can look at if you're interested in attending Utah State. So,
and that's where I got my undergrad, Utah State. So they were great and they were so helpful. They have like pre-med groups you can join and things like that. So
that's perfect. Yeah, I noticed they had a pre-med club already established as well for students. So that's great. Perfect. So, okay, I think that's it. We don't have any questions in the comments, but if anyone has any questions later on while they're watching this as a recording, let us know and we can do our best to answer anything that you are wondering about. So thank you so much, Reagan, and thank you so much, Crystal, and we are good to go. So thank you guys.
no problem. Have a good day.
Thank you.